So to give a little demonstration about what kind of happened in Christine is it should be like this when the upper spine here shifts in that opposite direction and then we get pressure on those discs. It causes inflammation in that spot. Now those nerves that go to the shoulders, the arms, and the hands start right here. The more inflammation or the more irritation or the more pissed off it is on the inside, the nerves will then start to be affected. The further down the train tracks that we go, the more inflammation there is. The less inflammation there is, as we get it better and better and better, it won't start to travel down as far. It typically starts with localized pain, then it'll lead to a little bit of numbness and tingling. When the numbness and the tingling has then been in there for a little while, that's how we start to lose a little bit of grip strength loss, or even not being able to raise the shoulder above the head or put a coat on, things like that. This is an example of infrared thermography, which is something that we use here in the office. That's fancy for meaning it takes pictures of heat pictures. The temperature scales over here on the right-hand side. The white up there is hot, inflammation. The purple down there is cold. This is the upper area right here. The white areas have the most amount of inflammation. So we can see when we have irritation that's happening right along here, right in the middle where that curvature starts to go forward a little bit, that's what's causing the pressure on the discs, which is then what causes the numbness and the tingling to the arms, the shoulders, and the hands. As this reduces and we get rid of that inflammation, this stuff that's attached to it, the symptoms basically go away. So what we do is we periodically will take these temperature pictures at the beginning and then throughout care as the inflammation starts to shrink, because it'll start in a wide area and then it'll shrink to a much, much smaller area. That means we're heading in the right way and we can change the frequency of your care and start to drop you down because we don't have to see you as often, because things are improving exactly the way that they should.